because we have a holistic approach where we encompass everybody from the nursing care to the doctors to the therapists, and we all
Mm.
attack it together. So they all communicate and they're all able to, you know, work together for the best outcome for the child.
Well, you would assume that would happen everywhere, but
Uh,
apparently
yeah,
not,
so
right?
yeah, we have to come to us, our director of nursing, they learning about the child at admission, and they ask a
Hmm.
lot of questions. They need to know the whole history, and they take that information, gather information from all the specialists, their primary, pediatrician, and then compile it into a plan of care for 6 months for the child.
Hmm.
So throughout that 6 months, it's how what we're going to do for them and how we're going to care for them, and
Hmm.
then that goes back to the doctor for signature. It, when we get it back, that's what we follow, and our director of nursing kind of holds that all together.
Mm.
So they're in
Yeah.
contact with the doctor, they're in contact with the therapist, and they're in contact with the parents, so everybody is on the same page.
Oh, that makes sense. I love that. My dad told me I should be a director of nursing. I said, I don't want to go to nursing school. He's like, that's a really
So
good job.
you could be a
I don't want
director
to
of
do
nursing
that.
at TenderCare, and you know, it's a little different than your typical director of nursing job. You get to interact with the children, and it's very fulfilling.
Yeah, I mean, I know that it is, but whew, it's a lot of work too, man. That's a
Oh,
tough
it is.
job.
It is.
Uh, so talk about the expense, because I know parents are like, one more expense for my kid, especially if there's medications or support, like blah, blah, blah. How can parents afford a service like tender care for their child?
So that is the one amazing thing. With Medicaid, it is free to the parents. Medicaid covers everything from our care to therapies to transportation. Um,
Oh, wow, even transportation. That's
yeah.
nice.
And if the family doesn't qualify for Medicaid, now they can apply for Florida Healthy Kids and pay um, whatever the amount is for under five, and it's a Medicaid lookalike. So children
Okay.
under five can get that Medicaid lookalike and have our services and pay that Florida Healthy Kids premium.
Oh, nifty. And then when it comes to like the transportation component, I'm assuming that you have all the vans, necessary equipment for individuals in wheelchairs or who might have mobility issues or things like that to get on
Yeah,
and off the
so
buses. Or
all of our vans are equipped with a wheelchair lift.
okay,
They're um, all of them are Mercedes Sprinters and have the ability to transport four wheelchairs and five patients. They're not all that full, but typically a center has, some centers have four vans leaving, some
mm-hmm.
have 7 to 8 vans leaving every morning. And
Wow.
on when they leave, there's an emergency med kit that is on every van, as well as either a nurse or a CNA as an escort. So not just our driver, but there's a CNA or a nurse escort to make sure that the child is safe during the ride and everything is good as far as their, nursing needs.
And how many individuals can each of your facilities support on a day-to-day basis?
So each one's a little different because of the space and the size of the facility.
Mm-hmm.
We are licensed through ACA, which is the agency for, or it's, I should know this.
Acronyms,
Yeah.
acronyms.